Hey, hi. So right now I'm in Pune and I need to tell you why I'm here. And no, it's not a party or to meet anyone. It's actually way more serious than that. So, 5 days ago, I woke up with this insane pain in my tooth. For the first 2 days, I just popped up some painkillers and ignored it completely. And I hoped it would go away. And it did. But it was very temporarily. But I knew something was wrong. So I finally went to a dentist and he took an X-ray and what he found completely shocked me. So see this. Years ago, I had a root canal done. But here's the problem. The dentist didn't do it properly. And because of that, that caused the infection and spread into two other teeth. I was sitting there thinking, what do I do now? This is serious. So I called my friend who is an MDS, that's a master of dental surgery, and he told me to come to Pune immediately. He is a third year resident doctor here and he started treating me right away. And that's when I realized something. Root canals. Root canals are everywhere now. So many people are dealing with it. So I thought, why not make a video about it? Let's understand what root canal actually is, why is it becoming so common, and what do you need to know. So with us, we have a very dear friend of mine, Dr. Gyan. He is MDS and he is expert in root canal. So I would like to know what is root canal.
So root canal is basically we remove the infected pulp tissue from the tooth and shape the canals so that it can be appropriately sealed with a filling material, especially called as gutta percha, and a sealing material, that is a sealer. So it is basically done to save the tooth, and it also helps to make the natural keep the natural dentition in your mouth.
What is canal?
So canal is basically it is the what we can say, it is a channel that runs inside your tooth. It occupies the soft pulpal tissue which carries the blood circulation or nerve innervation. So these all structures, they are actually basically living tissues. So when this gets inflamed, you will suffer from a severe pain.
And how does actually it happens? Like consider I do have a very clear teeth and why it happens and how it happens.
So basically your tooth decay, it doesn't start from a single day. It takes a long time, like from around 6 months to 1 or 2 years. So it usually starts from a single pit, or we can say small pinpoint decay, which is mostly you will see notice at a blackish discoloration. So with time, by accumulation of food debris and by your improper oral habits, hygienic habits, this pinpoint lesion, this gets and the bacteria which gets accumulated on your tooth. So this all makes the decay more rapid, and then it gets uh, towards a pulp and then make it.
And how does it like? And basically based on all the foods what we eat, and if it doesn't get cleansed properly, it starts to happen. Am I right?
Yes.
Understood. And what actual procedure you guys use when you do the root canal?
So actually what we do, we remove the infected tooth structure. That is whatever the part which has been decayed. And then we locate the each and every canals orifices and then start preparing it. Basically it was usually previously called as biomechanical preparation of the canals. So in that we shape shape the canals accordingly in order to remove the dead pulp tissue and make it to in a conical taper so that we can fill it with the inert material which is called as gutta percha, and then we seal it with the permanent filling material, and then we place a prosthesis.
And consider if you'll have to explain it to me, like I'm coming to you with my tooth which is completely bad in a bad shape and that needed to be root canal. So very first thing what you're gonna do?
So firstly, whenever you will visit to me, you will obviously you will say that you have been suffering from a severe pain, which has been throbbing, and you have been unable to sleep at night, or it is continuously aching, and it gets aggravated while you are taking any other hot or a cold beverage. So at that time, I just diagnosed, see it clinically, and then after clinical examination, usually we used to take a radiograph to confirm it, and there are also various pulp vitality testing. After that, after the final diagnosis, we just start the treatment. So in the treatment, what we do, we just, as previously said, remove that all the dead tissues. Then after that, we locate the orifices, and then we try to disinfect the canal.
Sure.
So disinfection part, it makes in combination with the preparation, that is filing the canals by using the special aeronautic files which we have, and by using special chemicals like sodium hypochlorite in various combination. The most recommended is 5.25%. And then the files which are being used in sequential manner along with the continuous irrigation and rinsing with saline. We take the proper cleaning and shaping, which is also called as chemomechanical preparation, and then at last we fill it with the gutta percha cones.
And why the cases are increasing these days?
You can say the type of dietary habits that we have been shifting. So previously we used to have more on a raw foods or something which is more fibrous intake. So nowadays we are shifted more towards the processed foods. It contains more of your carbohydrates, sugars, direct sugars. So, and then your oral hygiene habits, which are being both triggering these conditions.
Understood. So basically, the packed foods are not good for us.
Yeah, the packed food, and also your eating habits. Like if you're frequently having some sugary foods or anything else, and you're not rinsing it your mouth properly, and then frequent exposure of sugar, that makes the things more.
They say brush your teeth at least twice in a day. How does that
it is
work?
actually usually recommended that we should brush our teeth twice a day, and it does makes, because usually what after brushing we mechanically remove the debris, the plaque, so that things that bacteria didn't get that amount of that plaque material to get accommodate on it.
So I just want to know what happens if like someone has a root canal and it didn't get treated, and the guy didn't get the treatment. What would happen?
So if that infected teeth has been not treated, so the bacterial toxins and the their byproducts, they will get leach out from the root beyond the tooth structure, and it can infect your periradicular area, like your jaw bones, the soft tissues are coated, and it can affect that bone, which might lead to a condition called as osteomyelitis, that is infection of a bone in normal terms. Also, it can make a cystic lesion or any other type of cystic lesion, which is basically called as a granuloma, perioperic granuloma. So it ultimately affects your entire that tooth plus that surrounding structure.
Understood. And what are the prevention signs we can take measure of so that no one can face it, at least try to avoid it for a longer period of time?
So it is, as usually it is been said, that prevention is better than cure. So you should regularly visit your dentist. Like in every 6 months you should give a visit, and if there is any small filling or small cavities in your teeth or decay, restore it as soon as possible, which will inhibit the progress of your decay. And then if the teeth is being affected by this caries till your pulp tissue get infected, then the ultimate treatment plan is root canal therapy.
Understood. And like, can you just tell me what was the difference? What, like, how one can get to know that one is a good root canal and another one is a bad root canal?
Actually, it is a nice question. So here you can see the radiograph of the two teeth. It is basically the molar teeth, first and the second molar, which can be seen. So here we see that both the teeth are being root canal treated. So in the first teeth you can see it is being treated by someone, but it is not that properly done, because here we can see the canals are not being properly shaped. First, basically, what is canal? So here you can see the entire tooth structure, and these are the roots of the teeth, and inside it is a hollow structure which are called as canals of the teeth. So this canal accommodates the soft tissue of which is also called as pulp tissue, and that tissue has the innervation of blood supply, nerve supply, and that leads to the that nerves which exit from this tooth structure, they get towards the brain. And then here in this radiograph, I want to say is ki, as it has been seen, the tooth has tooth is number 6. So in this tooth distally, the radiograph shows that there is widening of the pedial in both mesial and distal roots, and the cleaning and shaping is not appropriate. Apart from it, in the distal root there is also one canal which has been missed, and the tooth is showing radiolucency in the furcation area plus widening. So it has been evident that it is not been properly cleaned, shaped, and the bacterial flora might be growing there. Whereas in the next adjacent tooth, which is the tooth number 7, here you can appreciate that entire the canal anatomy is been clearly cleaned and shaped. All the curvatures are being maintained, and the gutta-percha cone, which has been, you can see that it is a radio-opaque material. It has been sealed and it is filling till the apex of the teeth. Also, there are no voids are being visible. Here you can see in this teeth there are a lot of voids which might lead to secondary infection, and then retreatment will be required. But in the adjacent teeth it is very normal. Also there is no widening, and then you can say that this teeth is being adequately treated.
Cool. Thank you. Thank you for your time.
Thank you.
So, here's what I learned from all of this. 1. Don't ignore tooth pain. I wasted 2 days just taking painkillers when I should have gone to the dentist immediately. 2. If you're getting a root canal, make sure you go to a qualified dentist. A bad root canal can cause even more damage, like what happened to me. And 3. Prevention is everything. Brush twice a day, floss, and get regular checkups. It's way cheaper and less painful than fixing problems later. You have been putting off a lot of dental visit. Take this as a sign. Don't wait until it's too late. That's for this video. If you learned something, hit that like button. And if you have any question about the root canal, drop them in the comments below. I'll connect with the doctor, and take care of your tooth, guys. I'll see you in the next one.